Well, I think in the interest of everybody's time, we're going to get started because we have some folks that are joining us. So, Sheila and Kathy did a presentation, I think actually a couple presentations last summer, and about the e-nursing care that they're doing. And well, it's probably 3 weeks ago now that I had the opportunity to connect with them. I wasn't able to attend their sessions last summer and was able to connect with them virtually. And I don't know if they appreciated it or if they just tolerated it, but I had tons of questions like, how in the world can we really do e-nursing with elementary students or with special education students, and how does it work? And I have to tell you, they did such a fabulous job. Kathy and Sheila, I don't even think you know this, but I reached out to a couple former colleagues to say, hey, if you ever need nursing care, these are the people that you need to reach out to. So I'm glad that you're able to join us today, and I'm hoping that you'll find this helpful if you are looking in your districts for some additional nursing support. I think there's some really good potential here. Sheila's face is not on the screen because in order for her to present and you to see what she can see, she needs to be off. So I think she'll join us visually later, but
True.
for now, she's going to stand off in that way. So Sheila and Kathy, I'm going to give you a heads up. I have to step off about 12:15 to make another connection, but I'm going to give it to you to take away.
Thank you so much, Lori.
You're welcome.
Sheila, should we just start with introductions quick?
Please, let's do.
Okay, sure. So my name is Kathy Nicholson, and I've been with Avel eCare for about 13 years. And our roots actually are with Avera, and I don't know if you're familiar with Avera, but we were acquired last fall by an investment group, which really allows eCare to expand their services throughout the whole country. So our hub is located right in Sioux Falls, South Dakota. We lovingly call it a hub, but it's really a virtual hospital where we have services like emergency pharmacy, ICU, school health, senior care, behavioral health, and school health is embedded right in the middle of the other services. It's a 24/7 operation, and we've actually been around. This is our 30th year. We began in 1993. So I'll give it to Sheila.
And then my role is I'm the director of the school health program. And so my background is I've been a school nurse for about 20 years, working in big rural, I would say not big, I would say rural school districts where I did a lot of driving between my buildings. And then our largest attendance center in our state, which is Sioux Falls, South Dakota, about 30,000 kids. And I was a building nurse there for 3 years, and then the supervisor for 3 years, and had a team of nurses that we served the kids with. And then I went to North Dakota and I worked public health, and we served the schools through public health. We had 7 counties and so many miles. And so really the telemedicine became a solution for me to help extend my nurses and the care that they could give, and just to take care of the kids that were so remote. And so the program itself, the school health program, began about 6 years ago with our school district, our local school district in Sioux Falls, asking for more nursing support. That's how it started. And we still serve them today, but then we got a federal grant that allowed us to grow out into the rurals. And so then we just have continued to serve where the needs are. So today we have 117 schools that we serve in 6 states. We have a hub of nurses that we cover from the 3 time zones. So we start at 6 in the morning Central Time, and the last nurse leaves at 5 o'clock Mountain Time, 5 o'clock Central Time. So that keeps us in the Eastern, Central, and Mountain time zones. So that's a little bit about us. We serve, our smallest school has around 5 kids. It's an island school in Maine, and it is very remote because they have service ferry service to their island 3 times a week. And then our largest schools are run around 1,000. Usually we share those schools with other nurses. In Minot, North Dakota, we serve all 19 of their buildings and partner with 5 of their on-site nurses. So we're going to start with a demonstration. All right. So what you're seeing right now, can you see my screen?
We can.
Okay, what you're seeing is the nurse view. So this is what the nurses see on our side, and what the school sees is where Kathy is right now. And so the school gets an iPad on a stand, and then what she's showing you is the Tidal Care device, and this is really our assessment tool. One of the things we love about it is it's easy, and usually we intersect with people like secretaries, paraprofessionals, principals, sometimes even superintendents. And so we need to have the equipment easy to use. And so we're going to do a little pretending. Since we're school people, we're pretty good at pretending. And Kathy's going to be the student and I will be the nurse, and we'll show you what we do. Go ahead, Kathy.
Okay, so my name's Kathy, and today my ear hurts and my throat is sore.
Okay, very good. All right, well, my name is Nurse Sheila, and so the first thing I'm going to do is I'm going to look her up in the student information system, whether it's Power School, JMC, Infinite Campus. We work in a variety of different systems, but we want to look the student up to see if they have any health needs that we should be aware of. And then the first thing we're going to do is we're going to take a temperature. So everything is run on the nurse side. And so it's a no-touch thermometer. And when we come out and do training, we teach people how to do everything. Well, good news today, you don't have a fever. So far, you don't need to go home. I'm so happy for you. All right. The next thing we're going to do is take a look in your throat. So it's blue dot to blue dot. Go up just a little bit, Kathy. I can't see. There we go.
This was an attachment.
Very good. And then we have throat paddles. And then we're going to take a look. So you can see what we can see in there. We do really get a good view. And so since we're school nurses, we never do diagnosis or anything like that. We just give the parents more information of what we saw so that they can make their best decision. The next thing we're going to do is we're going to make look at an ear. So again, blue dot to blue dot. I'm going to start the exam here. There you go, right there. So there we can see that the eardrum, we can focus it. Usually we get real clear pictures. Sometimes when we do the demonstrations, it's not quite as clear, although that's pretty darn good today, honestly.
And sorry to interrupt, Sheila, but an adult in the health office would typically be supporting Kathy in this process, right? So it's not like we're going to give the 5-year-old the equipment and say, you know, blue dot to blue dot. It's the adult helping support that.
Yes, exactly. There's always an adult that needs to be in the room with the student. So now we're going to look at skin. So we can look at rashes, and we can adjust. We use this to look at lacerations, a variety of things. You want to show your hair, Kathy?
Oh, we did talk about that, didn't we, in the event that we need to do any lice checks or anything?
Yeah. So we can help support identification of lice. And then the last thing we're going to show you is the stethoscope. And what I really wish is, I wish you could hear. That we can't manage between the platforms. But what we can do, here we go, just hang on just 1 second. Kathy, you want to take the stethoscope off and put it back on again? I don't think that it caught it. Okay, go ahead. There we go. So then what they see is it shows them, we show them where to place the stethoscope. And so we can listen to the heart, and we'll give the heart rate here. in case of asthma, we can, or, you know, we've been seeing a lot of anxiety attacks, so we do a lot of listening with the stethoscope because of that. Could show them where to put it. It's an amplified stethoscope, which means it goes right through the clothing. And then like can go to the back. And we can even listen more in depth to the heart if we need to. So that's kind of how the equipment works itself. When we're done, we then make a plan between the student, the helper, and the eCare nurse. So it's really like we're trying to teach our students to be healthcare consumers too, little pieces at a time. Now, what we would do with a kindergartner obviously would be different than what we would do with a senior in high school or something like that, but we're going to make a plan. So I'm going to say, Kathy, I'm sorry that your ear hurts, but it's not red. You don't have a temperature. I will call, well, usually we say, who's the best grown-up to call in your house? Who would that be?
It's my neighbor.
We're laughing because we had one of our littles that we said, who would be the best grown up to call? And the child was like, well, my mom always says if we're in trouble, we should go to our neighbor. So I think he's a pretty good grown up. And so, but we don't ever know who our children live with. And so we don't want to ask for a mom or dad, if it's a guardian, if it's an aunt or uncle, whoever it is. So usually the best grown up to call is usually how we ask that. So then we'll, in the call, we'll make a call to the parent. And then we'll call the school back with what the plan is. And then we'll do the documentation into the system. And so that's kind of what we do with the visit. I'm going to end the visit now, and then I'll come back on Zoom. And well, is there I should ask this, are there any questions? Okay.
I think seeing how all of that works is just super helpful.
Yeah. So let me get
And there's Sheila.
Here I am. So really what we do then is we as we do our visits, then we go through and then we follow up with the parents. We also do other things, like if it's a school that doesn't have any nursing services at the beginning of the year or throughout the year, we do that case management that a typical school nurse would do. We call the parents, we get the doctor's orders for our kids with medications or chronic care needs that we do. We do a review of immunizations. We do the report that's needed by the state, that lovely thing. And we just do what we need to do. Yeah, and from Denise, you're right. The adult helping the child is when we go in, we teach them how to take care of the equipment. So the equipment itself is washed with alcohol wipes. The cart can be a Clorox wipe, and then the iPad, just what you usually use. Mm-hmm.
Can you talk a little bit about the support that you can provide for IEP teams as well?
Mm-hmm. So we attend IEP meetings and 504 meetings. And really a lot of times if it's not a virtual meeting like this meeting, what they do is they just roll us up to the table and we join that way. And so we can help add our level of expertise to that. And also with the schools that already have nurses that maybe have multiple buildings, we really help to fill in the gap the way the nurse needs us to fill in the gap. So sometimes it's seeing the kids when she's out of the buildings, or he or she. Sometimes it's helping fill in the gaps by doing some of those care plans, getting those plans of action into place. We do go in and we train so that the staff can be delegated to. So we have a medication administration class that we have. We also have a unlicensed diabetic aid class that we teach, and then assess that delegation piece.
So Sheila, do you want to touch on how, I know we have the two services, the primary and extender, but how you also assign the school nurse?
Yeah, so we have two services. One is primary, like Kathy said, that's for schools that don't have a nurse. And the second service is the extender, where we partner with the on-site nurse. But we know that no matter how good the equipment is, really you have to have a relationship. And so our students, our chronic care students especially, we try to make sure they always have the same nurse or two nurses. So if you think about the students with diabetes, that's real important for that continuity of care. And then the buildings are assigned a nurse. And so that's the person that they talk to the most often, who, if they have needs, if they have concerns, if they have a kid that shows up at the door and has all these health issues, then then they know who to call. They know who is their nurse on site. And it's also helpful then with the partner nurses in the extender program, because the nurses just really partner together. And we've had some real success this year with some nurses that are new to school nursing. And they have we send them our orientation notebook, and then they've become real good friends with their eCare nurse as they've learned about being school nursing. And then I meet with them as needed as a nurse administrator. So Kathy, one of the things I thought we might talk a little bit about is a grant that we're involved in right now.
Yes. Okay, great. So we were awarded a grant through the Juvenile Diabetes Research Foundation, as well as the Helmsley Charitable Trust. And that funding is really to support the type 1 diabetic students in school. So if your facility has even one child with type 1 diabetes and the family's willing to partake in the research, that will cover the cost for the whole student body at 90% off the first year, 60% the second year, and 30% the third year. So it's really a great way to get the services into your school and also support those students with diabetes.
So the grant really, the purpose of the grant is to show that how an intersection of a school nurse can affect clinical outcomes. So we know that school nurses affect educational outcomes, but we need some data to show that we affect clinical outcomes, so we can go to payers such as Medicaid, state Medicaid's offices, the Blue Cross, Blue Shields, just different insurance people to say, you know, it's worth your money to put it into school nurses who are really those front lines. And so that's really what the grant is about. And like Kathy said, it's 90% this year, 60% next year. And then if we get a no cost extension, it would be 30% the following year.
Any questions up till now? You know what, Sheila, one other
Sheila, sorry, this is Denise. Sheila,
Yeah.
I think we might also want to say, or let folks know, that you stay current on Minnesota policies, procedures. Your nurses have to have a license to practice in Minnesota. So maybe you just want to talk a little bit about that, so that people understand that, you know, that what the care that would be given in Minnesota can be tailored to the rules and regs in Minnesota per se.
Okay, thanks Denise for mentioning that. Yes, so our nurses are licensed in Minnesota, and then they're public health nurses, and then they're licensed school nurses. And so we do a lot of that kind of intersection. When the rules changed last year related to education of seizures in the schools, we developed a class and that was specific to the schools that we serve. We also do oversight of LPNs in a couple of our current schools. And so that's been a great partnership to do it that way as well. And then if I have questions, I ask Denise, is what we do.
The other thing, Sheila, I'd like you to talk about is, because we get asked for it so often, is behavioral health services.
Yeah, so school nurse is considered a passive consent. So if you think about if a student wants to see a school nurse in a school, they are able to come to the nurse. Now they can actively opt out, but they don't have to have a passive consent. They don't have to have an active consent. So we also offer behavioral health services. It's a consented service, a per encounter. And so where the kids get therapy, we work with in partnership with a school counselor, and then the school pays for the therapy bill, and then that's how it's reimbursed. So we do not bill that, but it is a consented process. We can send more information out if we want to do that. So I see there's a question about delegation and how it's handled. So it's handled similar to how you delegate when you're in the building. So in Minnesota, we have to make sure that our staff are trained with that medication administration. And so when new meds come on, they come on with us. We've already done the training ourselves. And every board of nursing that I've talked to, we're in 6 states. Every board of nursing that I've talked to, you can do training online, but you really have to do competency in person. And so that's how we do it. So when we come out, we do the competency, make sure people can do the skills that we ask them to do. And then if you think about your kids with diabetes, we do training as well with that. And then it's really more specific. It's really generalized training, and then with specificity to the child that's being delegated to. Really following that delegation tree. So can we delegate everything? No. Is this a service that's appropriate for everything? Definitely not. But it is a service that's appropriate for most things. You know, like if you have a kid that has a trach, we're not the right fit. But if you have a nurse that has 2 or 3 buildings that she's responsible for, and there's diabetics in the different buildings, it's a good fit. So far this year, we've done over 10,000 visits. And so we are skilled at what we do just because we practice it so much, whether you're talking about the head bumps or whether you're talking about oversight of insulin, writing the care plan, setting up the plan of care for our educator colleagues.
And you'll even work with the food service departments. Yes, I always think that's such a positive to do the carb count ahead of time on the menu.
Yeah, so some of the schools that we go into have never had a nurse, and some of them have less than robust, dietitian or food service type with the paperwork. I think they do a great job of taking care of the kids and feeding the students. But so we work with the kitchen staff to figure out the carbs, making sure that the carbs are accurate for our kids with diabetes, and how that works. And so it's really multifaceted how we do that. Other questions? So I think it's good to be clear too that this is not a replacement for a nurse. It's not like we come in and then it's no longer necessary for a nurse. But there's a lot of schools that they cannot find nurses. There's schools where they just need to make it so that their current nurses don't have to be traveling all the time. I know that I could never be at the right school, no how long or hard I tried. And the minute I left one building, I was needed at that building. And so it seems like there was just so much time that was lost of productivity. And this helps to help keep your staff productive. It helps with staff retention. I think some of our support staff, if there's not a nurse in the building, it's nice for them to have this as a backup so that they can feel like that not all that responsibility is on them. So some of our schools are fairly remote. So when 911 is called, it's a 30-minute wait. Others are fortunate to be in the cities and it's just a few minutes wait. So that's a little bit about our service and what we do. Now, pricing wise, I think that what we would suggest is that because there's so many different kind of extenuating circumstances, whether it's an extender, primary, the number of students, if you're interested in learning more about the pricing and how that would look, or more about the grant, it'd be best for you to get in contact with us. And I believe that there was contact information in the invitation, because there's a flyer there. Or if you want to email us, Kathy, you want to put your email in the chat?
Yeah, I just did. I put it in
Awesome.
the chat. And like Sheila said, our pricing is based on student enrollment. There's a technology fee and then per student fee according to the model that you use. So it takes me no time at all to put together, create a proposal for you. So I'd be happy to if you reach out to me and let me know that student count and whether it would be an extender or primary. We could get that information to you. Anything else about the equipment or the services, the grant? We find most of our, or I should say many of our schools do qualify for the grant. I thought, just one diabetic student in that building. So it's a great way to get started with a program with that grant funding.
All right. Well, if there is no further questions, we will say goodbye for now and hope we can hear from you soon.
Thanks for joining.